proposal to push for a supervised drug consumption site in Richmond, BC drew some intense backlash this week. People gathered at Richmond City Hall to protest for and mostly against the motion. That passed last night. Now, ultimately, the decision to create or not such a site will be up to Health Canada and Vancouver Coastal Health. Let's bring in DJ Larkin. She is the Executive Director of the Canadian Drug Policy Coalition at Simon Fraser University. Appreciate you coming in. You know, this is a public health crisis. Why do you think that there is so much controversy around this?
There is so much misinformation. BC has been under a public health emergency since 2016, and ever since we have seen a rise in misinformation, misunderstanding, and a politicization of what is healthcare, emergency healthcare.
Talk to me a little bit about some of that misinformation that you are seeing out there being proliferated.
So, first, safe consumption sites do not lead to increased drug use. They do not lead to increased public safety concerns. They save lives. They decrease litter. They give people somewhere safe to go who otherwise would be in public places. There is also misinformation about the housing crisis in BC and across the country. There is a dramatic increase in homelessness across the country. That is being blamed on the public health crisis related to the toxic drug supply. That is not true. Governments are failing to house people, therefore more people are in public places.
You know, we see this every time there is a conversation about a safe consumption site. There are, public concerns, NIMBYism, not in my backyard. Are some of the public's concerns warranted in your view or not?
I know that people do not want to see folks who are struggling in public. They don't want to see litter in parks, and everyone wants safe communities. Those concerns are real. The question that we have to ask is, what are the solutions? Safe consumption sites help. They help create safer communities. Housing helps create safer communities. Even people who use drugs don't want to be doing it in public, and they certainly don't want to do it in front of families and in places in parks.
So, what are some of the risks for those using drugs when misinformation is spread?
Over 14,000 people in British Columbia and over 40,000 people have died across this country since 2016. Those deaths were preventable. When people do not have somewhere safe to go, where they can be supervised, where there is an intervention that will save a life, people are dying. People are dying right now. So when people express these concerns, we are not taking into consideration that people are literally dying right now.
Why do you think it's so difficult to get that message that you're talking about through?
Couple of things.
Yeah.
One, we are so used to the word criminal. We are so used to thinking that if we punish people who are using drugs or who are living with addiction, that will solve the problem. It never has, and it never will. And there is misunderstanding about what safe consumption sites do. People have proliferated misinformation that this is enabling. It is not. It saves lives.
Do you think it has been politically charged, over-politicized in your opinion?
Politicians have seized on this issue because they want votes. They are not pointing to solutions. They want to politicize this issue to make people upset, because when they are upset, they vote. If people are upset, they need to be upset about the failure to provide healthcare, the failure to disrupt the unregulated drug market, and to provide housing. But instead, it's so easy to get angry at people who are marginalized, who don't have housing, and who we have been taught are criminals.
Let's talk about the motion in Richmond. It came as 26 people in the city died of toxic drug overdoses last year, among more than 2,500 who died across BC. That number, we've talked about that on this show. It's a shocking number. Once again, how are these sites going to help get those numbers down?
Right. In overdose prevention sites and safe consumption sites, hundreds and thousands of overdoses that could have been fatal are reversed every single year. Even if it's 26 people in Richmond, those are 26 preventable deaths. And if we open these sites in every community, it means less people are on the street, more lives are saved.
So to those who say, listen, you're encouraging drug use.
People who are using overdose prevention sites are people who are already using drugs regularly. People don't go there to initiate drug use. There is absolutely no evidence of that. This is about whether or not we want our friends and family alive tomorrow so that they can make choices and access care.
Is this a crisis in your opinion?
It is a declared public health crisis in British Columbia, and it should be a declared federal emergency.
You think across the country?
Across the country. That is over 40,000 people have died. They were preventable deaths. Today, someone was saying that you could compare this in Ontario to a small town's worth of people disappearing every year.
I mean, that comparison is shocking. There are concerns about the motion itself, most notably collaboration with Vancouver Coastal Health. Just last year, VHC told the council that Richmond did not have enough density of drug users to justify the site. So what do you make of that narrative?
It's a dangerous narrative.
Yeah.
First, because every single life matters. Those people mattered. Second, we need these services in every community so that we do not continue to perpetuate the lack of services in rural and remote communities. If people are going to make decisions based on density, how are we ever going to have harm reduction in Indigenous communities and on reserve and in remote communities? Those lives matter, and we need to pay attention to that.
It's an important conversation. Appreciate you coming in. DJ Larkin is the Executive Director of the Canadian Drug Policy Coalition at Simon Fraser University.